Hi, my name is Lisette and I'm going to talk about Tenofovir to prevent hepatitis B transmission in mothers with high viral load. Definition: Tenofovir is an antiviral drug that is used for the treatment of chronic infection by the hepatitis B virus. It works by decreasing the amount of HBV in the blood. Pregnant mothers with chronic HBV infection can vertically transmit HBV to their infant. This medication may be useful to preventing mother-to-child transmission. Let's see a video.
Hepatitis B is an infectious disease. Particularly in its chronic form, it is associated with severe suffering and even death. The outcome of an infection with hepatitis B virus is determined by the individual immune response. If this is insufficient, chronic hepatitis B develops. After HBV has entered a liver cell, genomic HBV DNA is transported to the nucleus, where it is converted into covalently closed circular DNA. This cccDNA functions as the template for the transcription of several
Application in nursing. Explain the importance of the recommended dose for the treatment of chronic hepatitis B. Monitor the patient as it should not be used to discompose patient. The nurse should be more careful in patients with renal fluoride.
Hello, my name is Gloria Wu, and I'm from the Leslie Dan Faculty of Pharmacy at the University of Toronto. On behalf of my co-authors, I will present the video abstract for our article published in a 2010 issue of Gastroenterology, titled Tenofovir and Tenofovir are the most effective antiviral agents for chronic hepatitis B, a systematic review and Bayesian meta-analysis. This research was conducted to evaluate the relative efficacies of the first 12 months of treatment for chronic hepatitis B. Since traditional approaches to meta-analyses normally only allow for 2 different treatments to be compared at a time, we chose to use Bayesian treatment comparison meta-analyses, which allows for multiple direct and indirect comparisons to be performed simultaneously. In addition, using this approach, we're able to determine the predicted probability of an outcome following treatment, as well as rank the different treatments based on their relative efficacy to one another. To determine the most effective treatment,
Pros and cons. Advantage. The combination of postnatal passive and active immunization reduces the risk of mother-to-child transmission from 90 to 10%. Disadvantage. If untreated, chronic HBV infection will develop of 8 to 90% of infants for born mothers who are positive for hepatitis B. In some people who took tenofovir and then abandoned it, hepatitis B got much worse.
The main treatment these days for HIV, many people use drugs that are in combination, such as 2 or 3 drugs in one pill, which makes it much easier to take. The main treatment we use nowadays in Thailand and many countries is a combination of tenofovir with 3TC or FTC and then efavirenz. So these are 3 drugs used together, and you could call the 3-in-1 pill. There's a company that makes it, and they call it Tripla, or there are generic drugs Now, tenofovir is generally very well tolerated. It's no longer like the old days that people have a lot of nausea and vomiting and diarrhea. It's very well tolerated. However, it has some effect on the kidney, especially in people who have low body weight, such as women who are small. So,
issue apply in Ecuador. According to Ministry of Health indicated, the total prevalence rate of hepatitis B in Ecuador is 32.6%, higher than that reported by the World Health Forum. The percentage of hepatitis in pregnant women are also high.
Good morning. Thank you for joining us. And we're going to continue our discussion on hepatitis B, which we have, as you will see, excellent therapies to suppress the virus. What we hope is, as these hepatitis meetings continue, that we'll be able to talk about meaningfully functionally curing hepatitis B as opposed to just suppressing the virus. But we're going to talk about, again, the therapeutic armamentarium we have now. So the good news is I don't have to go through a lot of this because Mitch has already done it with the hepatitis B and the DNA virus. Just to know here that as you see these patients in your clinics, just remember that hepatitis B, because of its worldwide prevalence, and the highest prevalence is in Taiwan, that immigrant populations clearly...
Conclusion. Infection with hepatitis B virus is a health problem worldwide. Vertical transmission of HBV can occur during pregnancy, delivery of neonatal period. Thus, the prevention of HBV transmission is the most effective way to reduce the global runner of the hepatitis B.
That all the markers that have been looked at in the study, some of them in the presentation, some I didn't have time to, either look equivalent or actually favor the new formulation of tenofovir. So, for example, there's less albumin seen in the urine, and there's less protein, retinal binding protein, which has been suggested as a good marker for tubular dysfunction. So, and everything that's been looked at to date, and we're talking about, it's a phase 2 study, so it's not as small as the study Matt presented on the NNRTI.